Today, I have got the wonderful Stuart Carmichael. He is a bit of a legend in the veterinary world in the UK about arthritis management. We're very, very lucky to have him. The internet is a little bit tricky today, so I'm going to try and shut up a bit and let him have much of the airwaves, okay? So what we're going to try and cover today is something very, very close to my heart, which is a better understanding about this disease and about the complexity of it, and how quite often the X-ray image or the palpation, the movement of the joint doesn't actually demonstrate the discomfort. But I'm going to let Stuart go into that in greater detail for you. And then we're going to get the legend to talk about how he works up a case so that we can all kind of see the complexity of working up a case. So Stuart, please tell everybody a little bit about yourself and then we'll move on.
Okay, thanks, Hannah, and I'm looking forward to seeing you not interrupt for a little while, which will be interesting. I say my name is Stuart Carmichael. I am a specialist orthopaedic surgeon. I have worked in orthopaedics for all of my career, which started way back in '78. I've always been fascinated by osteoarthritis in all animals, but particularly in dogs and cats. And I have kind of spent a lot of time trying to work out ways which owners can actually get to grips with this problem, because it's not an easy problem, it's a very complicated problem. And that's what causes a lot of the problems for us, ourselves when we get arthritis, and for our pets when they get arthritis. And one of the things Hannah's charged me to do tonight is to try and explain why this complication of the disease presents us with makes it challenging for us to decide exactly what needs to be done. And the key thing here is, and the worry is, that arthritis is a painful disease, and we've got to be very, very sure that our animals, our pets, are not in pain. When they are in pain, we do something about it. And what I've tried to do is explain to you why, as in other diseases, like if you think about, if you've got a fever, you take a thermometer and it tells you straight away you've got a fever. That if you've got diabetes, you can take a blood test and straight away it tells you if you've got a problem with diabetes. Arthritis isn't like that. There's not one test we can use to say arthritis is a problem. So, and part of that is because of the way it affects the joint. Now, arthritis is one of these diseases which is a chronic disease. That means that it doesn't get better once it started the pathology. For some reason, the animal or we can't cure this pathology. So we have to contend with it. And it's then understanding what happens with this pathology inside the joint to produce the signs that we see our pets experiencing. And if we understand that, then it's much easier for us to decide when we have to intervene and what we have to intervene with. Now, arthritis is a disease of moving joints. And to allow these joints to move, they're actually quite complex anatomical structures. They have to be able to move without producing any pain. And they have to be able to move smoothly so that the surfaces don't become damaged. And so the essential component of the joint is the cartilage, which lines the joint, and the fluid within the joint, which acts almost like an oil. But it's more than that, because it actually supplies the cartilage with all its nutrients. And the cartilage itself hasn't got a blood supply and doesn't have a nerve supply. And unfortunately, it also heals very, very poorly. So for a long, long time, we thought we were very clever with arthritis. We thought it was just a disease of cartilage. It's not just a disease of cartilage. When the joint is affected, every part of that joint becomes involved. So the cartilage, the synovial fluid, the bone in each side of the joint underneath the cartilage, the joint capsule, which is the thing that wraps around the joint and contains it, and all the ligaments and structures within the joint, they all become involved. Now, the bad news for the joint and for us is that although the cartilage has got no nerve endings, and so it doesn't experience pain, the joint capsule has got a lot of nerve endings. And the membrane that lines the joint also, when arthritis occurs, becomes more sensitive than it should be. Now that's really important to understand, because pain is something, when it works properly, it protects us. Pain in arthritis usually doesn't protect us, it becomes part of the disease. And the reason for that is that the pain system becomes part of the pathology. I'll try to explain that. So when the joint becomes damaged, what happens is the cartilage starts to break down, the membrane around the joint becomes inflamed, and we understand that when there is inflammation, that becomes painful. And the reason for that is the chemicals that are released as part of this inflammatory process starts to stimulate the nerve endings, which are in the joint, and these go straight to the brain and tell us it's painful. So the disease is in the joint, but the pain is in the brain. And that's kind of really important, because as this disease keeps on going, so if it was just a single thing, let's say a dog runs in the park, twists its knee, lifts its leg up, and the joint's very painful. That's acute pain. So the dog knows not to use its leg, but after a day or so, that disappears. Everything goes back to normal. Arthritis isn't like that. The pathology persists. So this damage within the joint keeps on evolving, it keeps on developing, and it's not a lot of damage often, it's just small amounts, but it's just enough to keep the inflammatory process going in the membrane, and the membrane becomes chronically inflamed. And as part of this chronically inflammatory process, because of the chemicals that have been released, the body responds by not ignoring this, but in fact paying much more attention to it. So we in fact get more nerve endings and more sensitive nerve endings within the joint. And that is exactly what we don't want, because now something that would normally be completely routine within the joint produces pain. So if the joint moves, as it has to do, that becomes painful, not because there's a lot of damage there, but because everything is so hypered up that the joint is feeling too much. It's almost like having an allergic reaction in a way, where the joint becomes almost so attuned to pain that very small things, small movements, small differences produce pain. Now, when we go to look at arthritis and we try to understand, okay, there's a disease, how can I tell if my pet's painful or not? Well, I could look at an x-ray. Now, an x-ray tells us a little bit about the disease, and what we see in an x-ray is usually changes in the bone, and the bone is reacting to what's happening inside the joint. So we can tell from an x-ray if our dog has got arthritis or not. What we can't tell is if the arthritis is painful or not. And as soon as the arthritis is present, these changes are there for life. So we can x-ray the dog at any time and we'll see these changes. We'll know it's got arthritis. But arthritis is a condition which can switch on and switch off. So an x-ray doesn't tell us if the joint is painful or not. We've got to do that by examining the dog and trying to watch and understand to see if we can see the signs of pain. rather than being able to do a test which tells us the pain's there. And that means that we've got to be watching all the time, because, go on, Hannah, yeah.
Just because I'm happy to make people realise how many cases I probably missed through my career, in that I would see that a dog was painful, I would get them in, I would do x-rays, and there wouldn't be much change on the x-ray. And I'd think, well, it can't be arthritis because there's no changes on the x-ray. And I think there's been a few times that I've thought, well, is this neurological? Is there something else? What have I missed? And the x-ray didn't match the clinical picture. And then there's times where you x-ray a dog and you look at the x-ray and go, oh my God, how are you still walking? And the dog actually is coping with it amazingly well. And then for me, that's what's really incredibly fascinating about this disease, is every case is very unique. And you have to look at that dog and that joint and that image. It's quite complicated, isn't it? And you can have dogs where the owner thinks there's a problem, or the behaviorist thinks there's a problem, or the dog trainer thinks there's a problem, and we think it's related to the hips, and there should be some changes on the x-ray, but the x-rays don't look that bad.
Yeah, and I think that's a very common mistake, and in fact, it's interesting. That's one of the reasons I became really interested in arthritis to begin with, because like you, I was seeing these dogs which were being sent to me because they had terrible x-rays, but the dogs themselves looked fine and they were using the joints really well. And you suddenly realize, well, I kind of realized there was a mismatch between what we could see in the x-ray and what we could see in the dog, because, as you said, there were other dogs who came in who clearly had a problem, but we couldn't see anything in the x-ray. And it's only recently we've understood how the nervous system, the pain system, interacts to produce pain which is independent of the pathology that we can see in the joint. And that's really important, because it gives us two targets when we try to manage this. We've got to manage the disease inside the joint, and we've got to manage the pain outside the joint at the same time. And before we understood this, these dogs, which were in a lot of pain, we just didn't really know what to do. And I think one of the recent things, the recent developments is, and understanding this much better, we can actually sort that problem out, and we can deal with the pain because we understand that the pathology is in the nerves that are running to the spinal cord. It's within the spinal cord, it's within the brain. That's all part of the arthritis problem. So that the pathology is not just in the joint, it's throughout the whole system. And that's what we've got to, and that's one of the complications, where we've got to take a step back and try and think of all the different things that we have available to us to try and modify this pain, control this pain, and also get the joint back functioning properly.
And that's where people, when they talk about this toolkit, is lovely. So when you hear a lot of people lecture, they say, well, we have a toolkit. And I never realized how big the toolkit was until you kind of start learning more about the disease. And you have the toolkit, which is your drugs and your nutraceuticals and your lifestyle and your weight and your surgeries. And it was actually with you and Greg McGarrell, that I started learning more about the inflammatory changes within the joint and how we can potentially even influence the soup that's in that joint and what we can do to modify that, which is something that I'd hope that you can try and talk to people about, because I do feel that we look at arthritis in a very structural, mechanical way and forget about the biological aspects that are going on. And I think we all think of gnarly bone-on-bone rubbing. We think of the mechanical, abrasive, pulling on the joint capsule. And that's how we see that's the pain. It's from rubby. Someone told me the other day that it's the fact that the bone on bone is rubbing and it creates heat, and that's what creates pain. And I was like, no, no. The soup and that inflammatory change in those nerve endings and the nervous system, tell them all about that, because that's just going to add a whole layer of whoa.
And I think you're absolutely right, because we tend to think of the joint and our leg as a machine, and it's not a machine. It's a biological system, and I think that's one of the fascinating things about arthritis as well is we can often see joints when we look inside joints and we see all this damage, and it's like an X-ray. You think, well, this should be a really painful joint. But in fact, the dog is actually using the leg normally because it's a switch on and switch off. So it's the chemicals that are being released, the cytokines, the enzymes, which are breaking down everything's a balance in a way. So when we get an inflammatory process, there are lots of things that are released which stimulate the body's healing systems. But part of these healing systems are breakdown systems. And in arthritis, we tend to get an imbalance where the breakdown components overcome the healing components. And that's when things go wrong. And that's where they are maintaining, as well as breaking down the cartilage and affecting the bone, they are keeping the kind of cellular elements, the inflammation within the membrane active. And at the same time, this is actually also sending signals to the nerves. And the nerves themselves, the nerve endings, become, as I said, hypersensitive. So that if you think about a nerve ending, it's something like it has a trigger point. So the nerve ending is there. It can be subjected to certain things, which means it functions completely normally. And then it has a threshold above which it then sparks. And that produces a pain response. And if lots of nerve endings spark at the same time, then we feel pain. Now, the problem in arthritis is that the threshold that this happens at is lowered. So in fact, the thing that's causing the spark is actually something that's completely normal in a normal joint. But in an arthritic joint, that whole thing has become much more sensitive and the nerve endings spark much more easily. And the reason that's important is if we understand that, then we can start to mess with the chemicals inside the joint to correct this. And the mechanics then become the result of that rather than the cause of it. So when we look at our toolbox, as you mentioned, there are certain things in that toolbox that we know we can change this chemical, we can reduce this chemical, we can protect this nerve ending. So we're looking at the very specific parts of the pathology and just targeting them like a jigsaw puzzle, putting the jigsaw together to get a much better response. And that's why we talk about multimodal, multiple target therapy for arthritis. There's not a single thing. Certain single things will work, but they perhaps don't work fully, or else we would have the cure for arthritis. So what we're trying to do is we're using little pieces of this jigsaw puzzle to make a much better impact and get us a better result. And the nice thing about that is that there are different pieces we can use in different situations to get the same result. It depends on what we understand of the pathology. It depends on the individual dog, and sometimes it also depends a little bit on the owner as well to get the right combination for that particular dog.
Just
So I
in
think
because
that
it was just about.
it's one of
Sorry, I just had to plug my phone in because it was getting a bit low.
Okay, so it's one of these things that if people can understand that the other thing that's important to realize is time, because with time, the disease becomes a little bit more complicated. So in the early arthritic joint, the pathology is relatively simple compared to the late arthritic joint. So in late arthritis, we have to use different types of methods. So it's, again, understanding the disease, different types of tools from our toolbox to get the same effect as in the early disease. So again, the early disease is treated differently from the late disease. But the good news is they can still be managed. If we understand that, the late disease can still be managed as well as the early disease.
And I think that's what people really need to understand, is that arthritis has many different guises, and you could have the 4 or 5 month old Labrador who's got very little arthritic change that is visual on an X-ray, but those nerve endings in that joint are screaming and are so, sensitized, and they're sending so much information of pain. And that dog presents their pain in a more behavioral way of, I just don't want to be trained. I don't want to be doing as I'm told. I don't want you to put me in that room. I don't want to go in that crate. I don't want to get in that car. Or they might even be reversed. They might be really needy and over the top and impossible to calm down because they use their brain chemicals to keep their pain state low by being overzealous about everything, always on the go, all the way through to your 12-year-old Springer Spaniel that's got arthritis in multiple joints around their body, be it, intervertebral changes, hip changes, stifle changes, and that's quite progressed, but that dog's kind of okay with it and dealing with it amazingly well. And it's just, I can remember listening to you lecture years ago, and it was in Brighton at one of the conferences, and you said arthritis of the elbow is different to arthritis of the knee. Arthritis of the knee is different to arthritis of the hip. These diseases should be treated individually, but we lump all of these really complex syndromes under one word, arthritis, one name. How can we be so daft? And I think that was a bit of a spark for me, because it's so true.
And I think we are lazy. Basically, we like to think about things as easy things. And one of the things that we know about arthritis is it's not an easy thing. It's a complicated thing. And I think we're just starting to realize how complicated it is. And I think that is a great example of, the elbow, arthritis in the elbow. The joint is a very difficult joint to deal with, whereas arthritis in the hip, we can expect a much better result from that, whereas arthritis in the elbow is very challenging. So again, it's part of the complexity. So again, when you look at an animal and find out where the arthritis is, if it's in a certain joint, it may be more challenging than another joint, and multiple joints as well. Most older dogs have got multiple joints involved, but they cope, and it's kind of this coping thing, which is, it's one of the great hopes of arthritis is that it is a waxing and waning disease, which means that quite often the body can counteract it. I always think of arthritis as like a bad healing process that never ever achieves itself. But if it gets completely out of balance, that's where we get a lot of pain. That's where the pathology starts to accelerate. And these are the things that we've got to avoid. If we can reset that balance, then we can just keep everything functioning.
So tell them about how you would work up a case from the moment that it's in the diary at a practice. What sorts of things are you hearing and seeing and touching, and what kind of things are you thinking through the whole process?
Yeah. And I think, in fact, this is actually perhaps really important just now, where at this point in time, people are going to have less access to veterinary practices for the foreseeable future. So it's important for people to start to understand how they can evaluate their own dogs in a way. So with arthritis, where we start is with the story, because it's a chronic disease, and what the owner says, so I listen very carefully to how they describe their problem, what they're worried about, and then just a conversation about what the dog's doing, what it was doing, what they see are changing, because it's how the dog interacts with its environment that tells us there's something wrong or something that's not wrong. So the pattern is usually of a dog trying to cope. A dog that becomes very, very lame and stays very, very lame is usually not a dog with arthritis. There's something else going on there. And one of the first things we do is, strangely, is to make sure that arthritis is a problem and not something else. So you're looking for the signs that there's something else going on, because it's easy to say, oh yeah, it's arthritis. Well, if things change quickly, you've got to be sure there's not something else happening, which in fact is complicating the picture. So that's where you start with the history. You're looking for the history, and the history also lets us make a judgment of another thing, which is going back to pain. How much acute pain is there, and how much chronic pain is there? Because the chronic pain aspect of this, the kind of background pain, is manifest, as you said before, Hannah, with behavioural changes. So it's listening and understanding and making sure that fits. The next place we go is movement. So we're trying to look at the dog move, because one of the most common signs of arthritis is impairment of movement, often lameness associated with pain. And you know, when a dog's lame, it's usually in pain. When we're lame, we're usually in pain. And you know, people say, oh, my dog is lame, but it's not really in pain. And I never understand that, because I try to say to people, well, think about the last time you were limping and why you were limping. It's because there was something that was sore. So the way the dog moves, the lameness is a very obvious thing, but there are other things. Watching how the dog gets up, gets down, just kind of the way, is it comfortable? So it gives us an idea of how well it's coping. And again, we're looking for this pain. So that's the background. So the story and the appearance of discomfort. Then we've got to say, okay, is it arthritis? So if it's arthritis, we're looking for the problem in a joint. So we know from looking at the animal which leg or legs are causing the problem, which is really important, because that lets us know where we should pay more attention. But I always kind of start with do a general examination, so you look at every joint. And again, we're looking for very simple things. Arthritis causes swelling of the joint, and because it's a chronic disease, what we tend to get is associated wasting of the muscles. So we're looking for swelling of the joint, and we're looking for the muscles disappearing. Now, if we're lucky in doing an examination, we can compare one leg to the other. It's always good to feel the right leg and the left leg at the same time. So if someone's looking for a swelling of an elbow, for instance, if they feel both elbows at the same time and one feels different to the other, that is an indication there's a problem. They should feel exactly the same. So in doing an examination, the last thing I'll do is move the joint. So first of all, we'll feel the muscles, feel down the leg for any bumps, lumps, swellings, right down each of the joints. Now, we'll have an idea of which joint is involved, but it's important not to miss anything. Remember what I said earlier on, we start off by making sure there's nothing else causing the problem. We don't jump to the conclusion that arthritis is necessarily the cause of the sudden lameness that we saw, because a lot of dogs have got arthritis, but it's not causing them a very obvious problem. So we work down the leg, feel the muscles, feel the joints for swelling, squeeze the joints gently to see if there's any discomfort. And again, if we can do that in both legs at the same time, it gives us a good comparison. Then it's a question of looking at movement of the joints. And that's a question of very carefully and bit by bit, start from the bottom with the toes and start to move all the little joints in the toes, and then to the wrist or the ankle, then up to the elbow and the knee, and just move each joint. And when we move the joint, we're looking for a number of very simple things. We're looking in the first instance to see if the joint moves smoothly, which it should do. And joints with arthritis, often we get a rough feeling when the joint moves, called crepitus. And it's the thing that excites me. It's like friction. That's one of the things. But crepitus is caused by lots of different things. It's not just the joint surfaces. It's all of the tissue around the joint, which is very fibrous and thickened, which can cause this rubbing feeling. The other things we're looking for are if we try to move the joint and it's resisted, so that the dog is not happy. Now, you don't need to move a joint to cause pain. You can tell if the dog is unhappy and resisting. And we also know how much of movement there should be in each individual joint. So we can see if the movement we're getting is much less than it should be. That's another sign that either the joint's very painful or it can't move because of the swelling or the changes within the joint. So each of these things allows us to pinpoint a joint that's abnormal compared to a joint that's normal, and also to tell how much change there is and whether that change is a very long-standing change or a more recent change. And most of the information you get just from simple feeling the leg.
And I think spending quality time doing that is so important. And I've only learned this in the later part of my career. So I've been qualified for nearly 20 years. And I've been very fascinated in this area for 8-10 years a bit now, and I don't think I realized how slow and methodical and thoughtful to do this whole process. So I'm quite lucky. We've interviewed a lot of people and I've worked with a lot of really cool people, and the first pain exam of just looking how the dog responds to you gently touching different regions of its body and what the dog's saying to you of, don't go there, I don't want you to go there. And then the clinical exam where you guys recognize the temperature, the pulse, the respiration, that's the clinical exam that we vets do. And then going on to the neurological, where I must admit in my early part of my career, I didn't see the importance of testing for that in my suspect arthritis cases. So just checking for reflexes and their ability to withdraw and whether there could be another underlying reason that they're lame. But then into the orthopedic exam, you know, I missed a panosteitis recently. I missed one because I just didn't palpate the mid shaft of the bone and get, you know, a true understanding of where the pain was coming from. So, you know, we're all very, you know, fallible, but going through a very methodical process of that orthopedic exam and looking for everywhere, I'm amazed at how many dogs may present with a forelimb lameness, but when you move back, you'll find that they're very sore over their lower back or over their hips, but they weren't lame there. They were at their end point, so they showed their lameness in the front end because they'd lost the ability to cope there. Or vice versa, you've got dogs quite lame in their back end, but their elbows are just rotten. And you sit there thinking, how did you cope with such dramatic change? What's your feeling about imaging? Because this is obviously an area that owners get concerned about costs. And many people aren't insured and they're looking at money now and money in the future. What's your feelings on that?
Yeah, I think, you know, again, going back to you talk about these dogs with multiple pain problems. Again, it's all about balance. And, you know, if we can identify that arthritis is a problem and start to treat, then suddenly all of these other things start to sort out, because as you restore the balance, as you get things under control, everything else, because it's all compensation, and the muscles aren't compensated, the body's, they're trying to weight bear in the wrong way, they're trying to protect a leg, and as we start to control the pain, everything else starts to relax and sort itself out. So these very complicated starting points can become simpler as we work through them bit by bit. But getting back to imaging, imaging is one of these things where once we've got all the clinical information, we're pretty sure we know what's going on. Imaging tells us if that's correct or not. And usually when you do an image, you're doing it to make sure there's not something else there, which is much more horrible than what we're trying to treat. For instance, one of the reasons we'll look for imaging, we often don't need imaging as clinicians to tell us it's arthritis. We know the arthritis is there. But what the imaging tells us is the arthritis is not complicated by something else, which we could maybe treat in a different way. Or if there's something horrible like a growth adjacent to the joint, or if there's something like panosteitis is a disease, which in fact is a clinical diagnosis, but as you know, it's an imaging beauty because we can see it on an X-ray. It's a diagnosis. In arthritis, yeah, and in arthritis, an image gives us information about what's not there rather than what is there. And that's why I actually do think that if it was possible to X-ray every dog with arthritis, we should do it. But we don't need to keep on doing it because it's not something we measure the progress with. It's a one-off type thing. And the other time we would use an image is if our arthritic pet is doing something that's unexpected. If it suddenly becomes very painful and we don't understand why it's painful, that's when we're looking for something else to see if there's another reason for the pain. So imaging is of limited use in arthritis as an ongoing thing, but it's really useful for us to make sure we're not dealing with anything else but osteoarthritis. And that's why people, vets will often want to take that X-ray.
I think that gives me a chance to jump in and say something that I've started to include more in our owner workshops is owners be receptive to the fact that a vet might want to revisit the case with fresh eyes. So the dog might be a recognised arthritic and have been managed for 2 to 3 years, but that vet seeing that your dog's lameness isn't waxing and waning and improving and deteriorating, but is consistently bad, that vet does need to revisit the case because things change. And unfortunately, we aren't lucky in life that we just get one disease and that's it. You don't get dished your disease and then you're immune to everything else. You get more and you could be unfortunate to have multiple conditions. And I think for the vet profession, you know, for us first opinion practitioners, one of the really big boundaries and obstacles for us is this communication to say, I need to look again. I want to make sure I'm still treating optimally. I want to make sure there isn't another complication that I can improve where we're at from. And I think that's quite hard for vets. So do you feel sorry for them when they say, look, we need to revisit? What do you think about that, Stuart?
I think it's a really good point because, and again, it prompts me to think of something else that I wanted to say, and for people to understand that arthritis is a dynamic disease. And I think that quite often as vets, we make the diagnosis, so it's osteoarthritis, but that means very little because that's going to change with time and with age. And we've got to keep on revisiting it, even the arthritis, to try and understand if there's a different tissue playing a part in the joint, if the nervous system has now become out of control, which we have to temper down, and to try and understand how that change is occurring, because the disease on first diagnosis is essentially a different disease to treat on 5th or 6th visit, which I think maybe sometimes the owners don't understand. And then the vets get a bit embarrassed by, they think, oh, well, you think we're trying to redo tests. Well, these tests are really important because it's trying to reset. It's trying to identify what the important things are and what they aren't. And I think that's one of the reasons that arthritis is so poorly managed, because we don't do that. We don't spend that extra time to reassess before we continue treatment. And the consequence of that is that the treatments become more and more complicated, rather than the disease saying, well, in fact, this might be less complicated. We could do a very simple thing, but it's very different from what we did 3 visits ago. And it's
I think you make
to understand how the disease changes.
Yeah, something that aggravates me a lot, and this is me, and this is my opinion, so my soapbox, is when owners have diabetes diagnosed, they're on board with regular assessments and revisiting, checking the picture. Is anything changing? They embrace the diet, they embrace the medication. And there's a different attitude. If a dog is diagnosed with lymphoma, they embrace the workup, they understand its importance, they check whether their dog is responding to the chemo, they check to see if the dog's still in remission. And there's this understanding that there's a regular reassessment. And you see a bond forming with the vet over that because they need each other. And I just quite often don't feel that we get that with arthritis. And it breaks my heart because we see arthritis more than any other thing, but we don't seem to be able to create the team that we do with other diseases. People don't seem to put the same weight of importance. And one of the things that CAM does in a very miserable way is we keep reminding people that this is a terminal disease, guys. You know, this This is the leading cause of elective euthanasia. This is a reason that they have very poor quality of life for years before being put to sleep. If there was ever a disease that needs to be taken more seriously and have a bond between vet, therapist, owner, working together and making sure we've got optimal management plan, this is it. This is it. So I do get a little bit frustrated. I want to promote arthritis from being, oh, it's just arthritis, to, oh my God, this is so complicated, but we can do so much. We've hit like 40 minutes of me stealing your brain, because I know that you've already been recruited to come back in a couple of weeks by your lovely colleague, Karen Cook, to talk about what we can do for arthritis in the coronavirus crisis. I'm not going to steal all of your wise words today, but I would like to get you to give 10 top tips. Now, unfortunately, because of the poor signal, you're going to do 10 on your own.
Thank you.
So if you could give 10 top tips, very simple, applicable to anybody on any budget, in any area of the country or the world, what sort of things? 10 short tips. I'll count down for you. So number 10.
Right. Now, I'm going to qualify that in the first instance by saying something. Arthritis, what you've just said, arthritis is never really treated as an ongoing thing because there's nothing we can measure. It's not a simple thing we can measure. Mm-hmm. But the simplest thing we can measure is the clinical appearance of the animal, and anyone can do that. So the first top tip is to understand your animal's disease. Be familiar with it, understand it, and understand when it changes, because that is the sign. That is the test that we're looking for. And the second, so tip number 9 is that having grasped that, the owner is much more important as part of that test than I am or you are, because they can monitor what's happening, and they know. And then my job is then to tell them when they need to contact me, when things are actually going bad, but they understand it. So tip number 8 is understand that this is your dog's problem and your problem, and between you, you can do most of the stuff to control this. And the vets as experts can guide you, but guiding is a key thing. If we can give you enough information for you to manage it yourself, that's great. So that's 8. Tip 7 is pain is really important. Now, as vets, we'll often use medication, and people don't understand what's happening. To understand it, often we'll use medication to try and understand how painful the animal is, because the animal can't tell us. So we'll use medication to see if we can get a good response, and that then allows us to think of other ways to manage the pain. So tip 5 is there are many ways to manage the pain.
6.
And 6 is it? 6, okay. There are many ways to manage the pain, and as long as we can manage it, then we've got to find the right way for that animal and for that owner. Tip 5 is that try not to resist, even though if someone wants to use medication for pain, there's a reason for that. And don't make it difficult by pushing back on that unnecessarily. There are lots of safe things that we can use for animals which are great pain relievers, and trust us rather than resist us when we're using medication. There's a big pushback in medication for pain and arthritis, but sadly, it's one of the ways that makes it easier to do everything else. Tip 4 especially in this environment, do not medicate your dog, even though I've said there are pain medications that we'll use all the time that are safe. What you have on the shelf at home is not necessarily safe. So if you can't get to a vet, do not be tempted to give whatever tablet you have for arthritis to your dog, because there are a lot of problems with human drugs, especially given to dogs, and even things like aspirin, paracetamol have got to be used with great caution in dogs. So that's something which we may talk about when we talk about the COVID problem. So tip 4. Tip 3.
Yes, and now
tip 3 is tip 3 is to be optimistic. I think that arthritis is always a hard diagnosis, but in fact, if you understand what we've been saying tonight, you can understand there's a whole range of pathology. And if we can get a handle on what's causing the key problem, we can manage and maintain. Tip 2 is to understand that a diagnosis is the start of a maintenance approach, where in understanding the dog's problem, we can make things simpler over time and get the same result. But we don't fire brigade. We work all the time on lifestyle and all the things that might not seem important, but are hugely important. Tip 1 is remember that this is a disease that we can manage, but we've got to trust each other to do that. And I think it is about multiple reassessments, multiple resetting of the things we use, a lot of trial and error. But if we can just spend more time reassessing rather than treating, we probably are going to get a better result in the long term. That was a
definitely.
lot of
there needs to be
for 10 short tips.
You did really well. You did really well. There needs to be a new joint change in attitude, both owner and both vets realizing that this disease needs to have a different level of attention. So on that note, I just want the followers, CAM followers, if any of you are therapists, vet nurses, vet professionals, or super keen owners, Stuart's been working really hard with an organisation called the Veterinary Osteoarthritis Alliance to create a course. So it's a very complete foundational understanding course. You're probably looking around about 8 to 10 hours worth. I think I'm about 6 hours in now. It's long, but it's extraordinarily complete. And it is available online to do for a very kind sum of £50, which is nothing compared to the amount of information that's in this course. Realistically, when I first saw it, I thought it was going to be a £400 or £500 course, because there is so much in there. There's videos, loads and loads of information, and a very structured plan to your learning. It's part of the VOA's plan to start trying to create an accreditation system, so that practices that are able to offer more complex services for arthritis management, so more complex imaging, more complex intra-articular or surgeries, they can display that to the people that are coming to their practice. So owners of an arthritic dog know that practice is pushing the boundaries with their arthritis service provision. So it is part of a new venture, which I'm really proud to say that CAM is fully behind, and we're going to start working much more together. Cam is going to target the public more, and the therapists and the pet professionals, and the VOA, we're working with them to target the vet industry. So that is your practices, your vets, your vet nurses, etc. I'm going to put a link so that people can find it. It is worth its weight in gold. It's brilliant. And well done, Stuart, and well done, Karen. I really do put my hats off to you. It's good stuff. Thank you so much, Stuart. I'm really grateful for your time. You're a busy person. I will be seeing you in a couple of weeks, and I will talk to you before with our coronavirus crisis meeting. But thank you very much. And Cam followers, please say thank you in your little list below, and this will be available on YouTube soon. So thank you very much, guys. We're going to say goodbye tonight.
Thank you. Bye then.